Goldberg. Please come forward. We look forward to your testimony in opposition to the legislation. You have 5 minutes, ma'am. Please proceed.
I'm Sharon Goldberg. I'm an internal medicine physician. I've practiced medicine for 21 years, and my background is mostly academic internal medicine, hospital-based, clinical research, and medical education. I am going to skip many of the things I wanted to say because I didn't realize it was only 5 minutes. Wireless radiation has biological effects, period. This is no longer a subject for debate when you look at PubMed and the peer-reviewed literature. These effects are seen in all life forms: plants, animals, insects, microbes. In humans, we have clear evidence of cancer now. There is no question. We have evidence of DNA damage, cardiomyopathy, which is the precursor of congestive heart failure, neuropsychiatric effects. So 5G is not a conversation about whether or not these biological effects exist. They clearly do. 5G is a conversation about unsustainable healthcare expenditures. Why do I say this? We've been sitting on the evidence for EMR and chronic disease for decades. And now we are seeing all these epidemics appearing. So diabetes is the first epidemic. I think most of you know the statistics. They're very scary. 1 in 3 American children will become diabetic in their lifetime, and if they're Hispanic females, the number is 1 in 2. Okay. So what does this have to do with wireless radiation? Wireless radiation and other electromagnetic fields, such as magnetic fields and dirty electricity, have been clearly associated with elevated blood sugar and diabetes. That is what the peer-reviewed literature says. It is not opinion. The closer you live to a cell tower, the higher your blood glucose. That is based on hemoglobin A1C measurements. So the idea with small cells of putting the cells closer to people's homes and bedrooms scientifically is very dangerous. And from an economic perspective, it's dangerous. And you may not know this. I was shocked to find this out. But the way you create a model of diabetes in rats in the lab is by exposing them to 2.4 gigahertz. And this is not for long-term exposure. Once again, we have, so the other epidemics that clearly link from the science with electromagnetic radiation are related to mental health. And this is straight from PubMed. This isn't my opinion. This is science. Okay? So we have 3 epidemics that clearly, they're essentially one epidemic. We have deterioration of mental health in the United States. Don't have time to talk about them in 5 minutes. I wish I did. But we need to examine our epidemics in the context of our EMF exposures. What does that mean? That means that the CDC, tracking these epidemics, we need to start measuring how much radiation are people being exposed to, and before we roll out 5G. And this means there are 4 kinds of electromagnetic fields that we know are harmful to human health. So radio frequency radiation, magnetic fields, dirty electricity, and electric fields, okay? And all humans are affected by EMFs. What is our exposure in a day? It's not one cell phone. It's cell phones, it's multiple wireless networks, it's smart meters, it's cell towers. It's this sandwich, and it all adds up. And this is a serious problem for occupational health, public safety, and personal safety. And I feel that it's irresponsible to be even talking about the Internet of Things and rolling out a new untested technology when we're not even measuring what are our current exposures from the current networks.